Hello students, my name is Shivi Singh. I'm an assistant professor at the Department of Philosophy, Hansraj College. So today I'll be having a discussion on the topic euthanasia, and I'll be analyzing it from an ethical perspective. So it's an ethical analysis of euthanasia. So the content of the discussion that we are going to have is, first of all, I'm going to discuss what is euthanasia, the definition of euthanasia, and how the terminology euthanasia came. The second category, the second point that we'll be discussing is the categories of euthanasia. What are the kinds of euthanasia that are there? And what are the important categories among those categories which are there? So now, further, I'll move on to the moral debate which is there between the two categories of euthanasia, which is active euthanasia and passive euthanasia. Then we'll discuss the reasoning behind opposition of active euthanasia, because mostly active euthanasia is opposed and is thought to be illegal, and it is illegal in most of the countries. So after discussing the reasoning behind opposing active euthanasia, we'll be discussing the arguments which have been given against the opposition of active euthanasia. The advocates of active euthanasia, how they defend active euthanasia, and they believe that active euthanasia is something which should be opted for. Then in the end, I'll be discussing how and what is the status of euthanasia in India, and what is the legal status of euthanasia in India, and what are the things that made it legal in India. Then we'll move on to the conclusion. So let's begin with the topic. Now, what is euthanasia? Let's discuss first of all the terminology euthanasia. Now, the word euthanasia comes from the Greek term which is eu, which means good, and the term thanatos, which means death. So from this Greek term, the terminology euthanasia came. Now moving on, when we talk about euthanasia, what is euthanasia? What is the practice of euthanasia? So euthanasia is the practice of bringing a patient's life to an end, and it is done in the cases where the patient is undergoing a lot of amount of suffering, is under deep agony, and there is no amount of treatment that can cure the patient. So euthanasia is opted for, euthanasia is practiced in such cases where there is no other way to cure the patient other than, to take away the pain of the patient other than ending the life of the patient. So it is also known as mercy killing. Euthanasia is many times also known as, we hear people talking about mercy killing. So euthanasia is also known as mercy killing. Now, it is only performed in cases where no other form of treatment can cure the patient or can help reduce the pain that patient is undergoing. Now, moving on, what are the categories of euthanasia? The two major categories that we'll be talking about in this discussion are active euthanasia and passive euthanasia. Now, what is active euthanasia? When we talk about active euthanasia, what is active euthanasia? Active euthanasia refers to bringing an end to the patient's life by use of a lethal dose of drug. Now, as the terminology suggests, it is an action that is performed. It is actively something is done. So it is done so the patient's life is brought to an end by using a lethal dose of drug. Now, the second category, which is passive euthanasia, it refers to withdrawal. As it is passive, it refers to withdrawal of any form of treatment being given to the patient, any form of medicine being given to the patient. So we withdraw all sorts of treatment, all sorts of medicines which are being given to the patient, and it is done intentionally. So if the patient is on any sort of life support, that life support is removed, or if the patient is supposed to be given any form of life support, that is withheld. So that is passive euthanasia. And the patient eventually dies due to the illness that the patient is undergoing, the patient is suffering from. Now, there are other categories of euthanasia as well, as we can see, which is voluntary euthanasia, involuntary euthanasia, self-administered euthanasia, and many more. But those are not very important categories, and those are not even relevant to our discussion today. So we'll move on to discussing the moral debate that is there when we talk about active euthanasia and passive euthanasia. So when we talk about, there is a huge difference between active euthanasia and passive euthanasia, and that distinction plays a huge role in defining the boundaries of medical ethics. Now, if we talk about medical ethics, medical ethical associations take into consideration many factors while deciding that active euthanasia is right or not, or passive euthanasia is a better option to be opted for in case of euthanasia. Now, on various moral grounds, passive euthanasia is many times permitted in various countries. It is permitted in India as well, though the criteria of permission or how it is permissible, that we'll discuss in the end of the discussion. Moving on, when we see active euthanasia, on the other hand, is legal in very few countries, which are Luxembourg, some of them are Luxembourg, Belgium, Netherlands, and United States of Washington and Oregon. Only these are the few countries in which active euthanasia is legal. Otherwise, active euthanasia is illegal and is banned, is prohibited in every part of the world. Now, withholding treatment and letting the patient die is considered permissible, whereas, giving the patient any lethal dose of drug or taking any action to end the patient's life is considered to be something which is formidable, which is forbidden. Now, what are the reasons behind opposing active euthanasia? Now, there are two major arguments which have been discussed by James Rachels in her work Active and Passive Euthanasia. Yeah, so there are certain oppositions given by American Medical Association, which is AMA, as I have mentioned here, which they say that these are the reasons, these are the moral grounds because of which we should not opt for active euthanasia. And these arguments have been mentioned by James Rachel in her work, Active and Passive Euthanasia. Now, the first argument that is given, there are two major arguments. The first argument that is given is because of what the medical profession signifies, what the medical profession stands for. Now, when we talk about medical profession, the medical profession, it stands for the aim of all the people working under, medicine, the medical professionals, they work to save the life of the people. Whereas when we talk about euthanasia, what euthanasia is doing, it is an intentional termination. As we can see, it is an intentional termination of the life of the patient. So it is something, it is thought of to be something totally contrary to what the medical profession stands for. So it is totally in opposition of what, and it is totally contrary to the grounds on which the medical profession stands. So it goes against the very aim of the doctors, which is the prolonging the life of the patient. So this is one argument. Now, the other argument which is given is that of the difference between killing and letting die. Now, this is a very important argument. Killing and letting die. It is thought that, when you are performing active euthanasia, you are actively injecting the patient with a lethal dose of injection or a lethal dose of drug. But, there is always a difference. While when you talk about passive euthanasia, you're not actively doing something. You're not actively taking the life of the patient. You're just withholding the treatment that was being given to the patient. So there is a huge difference. There is a huge moral difference between killing and letting die. Killing, if we talk about killing in just normal day-to-day life, killing is something which obviously everybody has to abstain from. If you kill somebody, you'll be a criminal, you're harming somebody. Everybody in the world is supposed to make sure that they do not harm anybody, and killing for that matter is the extremest sense of harm. So we are not supposed to kill anyone. But when we talk about, the obligation of letting die, we are not obligated to make sure, for instance, the poor people, the people, let's take an example of a country which is, suffering from poverty. There is a lot of poverty there. So people are dying of hunger, people are dying because of hunger there. Now, it is not our duty, it is not our obligation to make sure that they do not die. So we are not saying, those people are dying because they are starving, but We are not making any mistake here if we let them die, because it is not our duty, it is not our obligation to save them from that. Now, moving on, we have arguments against the opposition. Now, so far we have talked about opposition, why active euthanasia is opposed by the medical association, team, and the American Medical Association, why they believe that doctors should not perform active euthanasia. Now, there is also a group of people who are the advocates of active euthanasia, who believe that the argument which is given against active euthanasia does not stand. Now, the first argument that was given was the ideology of medical professionals. Now, the ideology of medical professional was that one should not give or inject the patient with a lethal dose of drug, because you are taking away the life, which goes against what the medical profession stands for. Whereas, the argument against ideology of medical profession, it says that, for instance, a patient is suffering from cancer and is undergoing terrible pain. Now, no amount of treatment can help to reduce his suffering or cure him. So, the patient as well as the family of the patient asks the doctor to put an end to his pain. Now, what is happening? As a result, the doctor decides to withhold any further treatment on the ground that the patient is in terrible pain and agony, and any form of treatment is only going to prolong his suffering. So, since the patient is going to die anyway, simply withholding treatment may take a longer duration. One does know that the patient is suffering from cancer. So eventually he's going to die, eventually his death is going to come. But we do not know how long it is going to take. So it may take a longer time and more suffering can be caused to the patient. So once the decision of ending the life of the patient has been made, then injecting him with a lethal dose of drug, which is active euthanasia, opting for active euthanasia is a better option. It is thought that the advocates of active euthanasia say that if you opt for active euthanasia, if you take the option of active euthanasia, you will be easing the pain of the patient, you'll be ending his life in a less painful way, rather than just, watching him going through that suffering and his life coming to an end because of that illness. Therefore, active euthanasia is something which should be preferred over passive euthanasia. Now, moving on. Now, the second argument was difference between killing and letting die. Now, the opposers of active euthanasia believe that it is not opted on the ground that it is equivalent to killing someone. Now, if we talk about killing, why do we call somebody a killer or a murderer or a criminal? Now, killing, the most important aspect of killing is motive. When a person who kills somebody, if he does so, the motive behind him doing that is very important. So the killer or murderer has a motive which is benefiting because of the death of the person he's killing. So he has a motive. A killer or a murderer kills someone with the motive of some form of personal gain. Whereas when we talk about the doctors, they choose to intentionally terminate the life of the patient using a lethal dose of drug, which is active euthanasia, and they are motivated to do this by humanitarian reasons. They do so because they want the unbearable agony of the patient to go away, so that the patient does not have to suffer anymore. Therefore, active euthanasia is not at all something which is worse than passive euthanasia, but in fact, in many cases, it is an option better suited. Now, another important difference which has been mentioned by James Rachel in case of passive euthanasia is that those who opt for or decide to choose passive euthanasia, they believe that the doctors do not do anything actively to bring about an end to the patient's life. The disease is something which causes the death of the patient. Whereas in active euthanasia, the doctor is actively doing an action to bring about the death of the patient. But the advocates of active euthanasia say, James Rachel replies to the argument and says that the belief that the doctor is doing nothing in case of passive euthanasia is totally incorrect. because doctor is doing one thing which is very important, and the most important one, which is letting the patient die. So it is not that the doctor is not performing any action, the doctor is performing an action which is the most important one. Though he is not supposed to be responsible for the death, because he is doing that because of just to uplift the patient from the pain and the suffering that he is going through. Now, therefore, the moral assessment we get through these arguments is that active and passive euthanasia cannot, when we talk about the arguments of moral assessment of active and passive euthanasia, these arguments cannot be used to favor passive euthanasia over active euthanasia. There is no landmark difference between active and passive euthanasia in cases where euthanasia has been opted. The ground on which active euthanasia is opposed or is considered bad and that it causes death because it is a great evil is wrong, because when we talk about death in cases of patients who are terminally ill, who are undergoing so much pain, in those cases, death is not actually a greater evil. That death is something which they desire. So when we talk about in such cases, when it is decided that the patient is to be euthanized, even passive euthanasia, even by using passive euthanasia, it is believed that death is not that great an evil. Then the life of the patient, due to the terrible agony he's going through, is worse, and death would bring him peace. Hence, the doctor's argument for not willing to opt, or not willing to be the reason behind the patient's death does not apply in such cases when we talk about the cases in which euthanasia should be thought of. Now, moving on, we have talked about certain arguments which have been there, have been given by American Medical Association, or which have been given on ethical grounds, on moral grounds by doctors, why one should not opt for active euthanasia and passive euthanasia is better. Now, having discussed all that, it is very important that we discuss euthanasia, the status of euthanasia in our country. Now, euthanasia in India. Now, in India, on March 9, 2018, the Supreme Court legalized passive euthanasia. And how was that legalization done? It is done, the passive euthanasia can be practiced by withdrawal of life support and is permitted only in cases of patients who are in permanent vegetative state. Now, to offer passive euthanasia, one has to give the consent through what is called a living will. Now, this landmark decision was made because it was made as a part of the verdict of a case which was of Aruna Schonborg. Now, the case of Aruna Schonborg is a very famous case and has been the one because of which passive euthanasia was legalized in India. Aruna Schonborg was in a vegetative state for 42 years. And she was in vegetative state until the day of her death, for 42 years. Aruna Schonborg was a working nurse in King Edward Memorial Hospital, Mumbai. Now, on November 27, 1973, she was abused and sodomized by a sweeper, Sohan Lal. Now, during the attack, I'm sorry, it is written here attach, it is attack. So I'll just correct it. Now, during the attack, what happened is that during the attack, she was strangled with a chain, due to which her oxygen supply was cut. She was deprived of oxygen, which resulted in her being in the vegetative state. She was kept alive using a feeding tube for 42 years. Now, Pinky Virani was a social activist who filed a petition in the Supreme Court to end the life of Aruna Schonborg using euthanasia. Why she did that? She believed that the continued existence, she said that Aruna Schonborg's continued existence was a violation of her right to live with dignity. Hence, her life should be ended. Hence, her life support should be removed. But the court rejected the plea on the ground saying that the people who were taking care of Aruna Schonberg in the hospital did not want to end her life, did not want her to be euthanized. Now, the conclusion that we draw from everything that we have discussed so far, everything that we dealt with so far. Now, why is euthanasia something which is very important? Euthanasia is something which is very important because when we talk about our lives, it is our right. It is even mentioned in the Constitution of India that it is mentioned under right to life, the fundamental right, that we have a right to live with dignity. And then that is extended by saying, that is extended to death as well, that we have a right to live with dignity as long as our natural tenure of life lasts, as long as we live our natural life, and we also have a right to die with dignity. So the right includes that a person has a right to live with dignity until the end of natural course of human life. Now, this right also includes a dignified procedure of death. So in case of Aruna Schonberg, she was in that state, she was on ventilator for so long, for 42 years. So a person should not have to suffer like that and should not have to live a life like that. So therefore, a person's miserable condition, as mentioned in the discussion, if the person is in such miserable conditions, then one can opt for passive euthanasia and exercise his right to die with dignity. Though now if we talk about euthanasia, if law is not strict in case of euthanasia, then there could be a lot of misuse of euthanasia as well. Therefore, if euthanasia is legal, as it is legal in India, passive euthanasia is legal in India. So we have to make sure that if the laws of euthanasia are not strict, if there is not proper surveillance, then it could be misused by people. So euthanasia should be permissible only after proper grounds for choosing it are provided to the court. Now, therefore, we can say that euthanasia is not an evil, but a necessity in certain cases. We do not say that euthanasia is something that should be easily opted for, but if a person is in a condition that a person is not living his life with dignity, the person is in such a miserable condition, then the person should always have a choice, should be given a choice to make sure that he ends his life with dignity. Okay, so this is it for today's discussion, which was euthanasia and ethical analysis. I hope you find it helpful and it can help you with some of your studies. So I'll hopefully see you in some other video of mine, and I'll try to come up with an interesting topic which can help you with your studies. Thank you so much. I'll see you in my next video.